Hello and welcome to our webinar. This is the second in the series of Ayurveda awareness webinars presented by Wise Womanhood. And I am Tara Raphael, Ayurvedic practitioner, Maya abdominal therapist, energy healer, and former midwife. And tonight we're going to talk about simple Ayurvedic self-assessment. The purpose of this is to help you to start applying the principles that we began to learn in the first webinar, the basics about the doshas. And this is basically the language of nature that we're learning to interpret within ourselves and our environment and those around us so that we can optimize our abilities to be in great balance and full of the power of nature. I'd like to start with 3 ohms and then we'll launch into our topic for this evening. So, first of all, I'd like to talk about a little bit about how self-care with Ayurveda works best. There are many things that you can do to take care of yourself with Ayurveda on your own. And then there are certain times when it would be best to consult with your Ayurvedic practitioner to get more feedback, more ideas, more guidance. So I'm going to just list a few of those times for you so you can put them in your mind and be sure to contact your Ayurvedic practitioner. If you don't have one, I do consultations online as well as in person, so I'd be glad to serve you in that way. So the times to call or see your practitioner is that if you are taking herbs that are upsetting your digestion or you have diarrhea or constipation from them, if you get an acute illness like the flu or a cold or some other kind of fever, the very first signs of a urinary tract infection, if you ever have any suicidal thoughts, don't wait for an appointment, just call and talk immediately. If you are in an accident of any sort, it's important to calm the vata from that accident, whether it's a car accident, bike accident, falling, any kind of accident where you are experiencing some trauma or surprise or anxiety. If you experience a bereavement or a sudden shock of any other kind, there are things that we can do to help you through that with Ayurveda. If you become pregnant, it's very important to contact any of somebody who's giving you herbs, whether it's Ayurvedic practitioner or anyone else, because some herbs are not safe for pregnancy, and we may want to adjust that formula. If you don't understand the recommendations about your herbs or any of the procedures that your practitioner has recommended, please don't just put them aside. Many times the different procedures, diets, herbs all work together. So if you skip one part of it and do the other, it might not be giving the right synergy to bring you back to a healthier state. If your menstrual bleeding is prolonged or disappears, or changes in some unusual way. If your medical doctor or another practitioner starts you on a new kind of medication or herbal regime, or if your health status changes, that you have some new condition that is showing up. The other times is to when you have a sense of feeling not well, but you don't really have a disease, because that can often be a sign of toxins or ama, which we'll talk more about when we talk about the digestive fire, because that digestive fire is what helps burn up those toxins and prevent them when the digestive fire is strong. And we'll be talking about that in the fourth webinar. If you have things that are just like the beginning of something, like you feel kind of scratchy in your throat, or you just feel not yourself, you're urinating more than usual, or such, then we may want to adjust your herbs or give you a new diet or do some other procedures to help overcome those beginnings of what could turn into some kind of a sickness. And also, just when the seasons change, it's a common time to get sicknesses. And it's also a time when it's good to adjust your regime, because the seasons change. Then you go from Pitta in the summer to Vata in the fall. And then in the spring, you go from Vata to Kapha. And then in the beginning of the summer, you go from Kapha to Pitta. And these changes, we want to respect how the climate is, or if you move to a new climate. So for instance, if somebody is living in Colorado, where I live, the altitude is high, the air is thinner, it's very dry, it's often windy, it's a very Vata provoking kind of climate. And what I find is that when people move here from another climate that is more moist or warm, that they find that they start having different kinds of symptoms and things happening to them that they don't understand. And it's because they have put themselves in a new environment. Or if you change your lifestyle suddenly, that's another time, because again, your lifestyle is important. So that gives you some ideas of the kinds of times to consult with your Ayurveda practitioner. And of course, any time that you feel it's appropriate is always a good time. So when we're talking about balance and imbalance, there are different weights for different factors that aggravate our systems. And I think I'll go into talking about checking in. There's a whole routine that I'm going to give you in this video that you can do. And I learned this from my Ayurveda teacher, Alakananda Ma, at the Alandi Ayurvedic School. And I've kind of tweaked it a little bit in my own way. But basically, it just helps you get in the routine of thinking about different things in the morning to see where you're at, so that you can go ahead and adjust your diet, your lifestyle, your whatever you're doing that day to fit where you're at that morning when you get up. So this slideshow will kind of share this routine that you can start to develop for yourself. And if you want the slides to be big, when you look at the screen and move your cursor over the slides, then you'll see that you can make the screen fill the whole thing, and that way you'll be able to read the slides more easily. So these are simple Ayurveda evaluation techniques that you can do yourself at home. And so first we're going to talk about some that are useful for looking at the short-term daily tendencies. So this is the routine and of daily morning check-in. So we're going to go through this a little bit, and then we'll talk about each particular, many of the things more in detail as we go through this slideshow. So the first thing is to do a basic pulse reading, and you look at the dominant quality of the pulse and the dominant position of the pulse. So for Vata, the pulse will feel wiggly like a snake or worm, and you can go ahead and feel your pulse, and I'll be showing you a picture of how to reach around, and you use the first 3 fingers of your hand and reach around the back of your wrist, and you go beneath. There's kind of a little bump where there's a prominence on your bone. You go beneath that, and then you feel inside until you can find your pulse. And some people's pulses are very easy to feel. They're really on the surface. Other people's pulses are deeper. So you might need to go to different levels to feel it. You want to kind of feel the top level that you can feel, like, because it might change when you go deeper. And you're just going to feel under each of the fingers, and the index finger is the Vata position, the middle finger is the Pitta position, and the Kapha finger is the ring finger. So those are the positions, and then the qualities of each are wiggly like a snake is for Vata, jumping like a frog is for Pitta, and Kapha is like a swan, so it's kind of a fuller, it feels almost like a circular pulse, like a very graceful oval that's pushing forward towards your hand. And so those 3 pulses we'll talk about more later, but what you're feeling for is which one is most predominant on you on a certain day. Sometimes you'll feel them in, like the Vata pulse could be in the other positions, but let's just think of those 2 things right now, the quality, and if it's the first index finger or the middle finger or the ring finger that's strongest. So the next thing that you could check are your stools. So Vata stools are darker colored, harder, and they can be like pellets. Pitta stools are lighter color and looser, so they might be more yellowish. And Kapha bowel movements are large, formed, and they might have some mucus in them, either on the actual bowel movement or it could be in the water that might come loose from the bowel movement into the toilet water. Then you want to look at the tongue coat, and there's different kinds of coats and different positions, and we'll be going over that more later. The appetite for Vata is variable, and one of the hallmarks of a Vata kind of appetite is that you actually forget to eat because you're too busy doing other things. You just space it out. A Pitta will have a strong appetite and needs to eat to avoid hypoglycemia, and the Kapha is sluggish but constant appetite. The sleep patterns for Vata are being up early and can't go back to sleep. So if you wake up like at 3 in the morning and can't go back to sleep, that's a Vata imbalance. If you can't go to sleep at the first of night, excuse me, that indicates a Pitta imbalance, and that's when you stay up late or you wake up between 10 p.m. and 2 a.m. Kaphas can usually sleep all night and all day if you let them. So that's their sleep pattern. The taste in the mouth when you wake up can give you some clues as well. The Vata mouth taste is bitter and astringent, or maybe a metallic kind of taste, and it's dry. The Pitta taste is more of a sour taste, and the Kapha taste is more sweet or salty or having really thick saliva. If you have pain or tenderness in your body, again, you can have a clue if you're having more Vata, Pitta, and Kapha. So if it's in the hips, the lower back, the colon, and thighs, which are the seat of Vata, as we mentioned in the first webinar, that's more Vata problem. If you feel it in your mid-back, your solar plexus, or near the belly button, which is the small intestine, that's Pitta. And if it's the upper back, neck, stomach, or chest where you're feeling pain or tenderness, that is more of a Kapha kind of discomfort. So after you've considered each of these, then you can add them up. And you want to include intensity as a factor. So if something is really intense, then you want to give it more weight. Which of the doshas you need to focus on for that day. If you're interested in having an email with this in it for your future reference, please email me at wisewomanhood@gmail.com and request the daily morning check-in, and I will email it to you. So here is again the simple pulses, and there's a picture of how to take your own pulse where you would put your left hand with the palm facing up, and then you would put your fingers around the back as shown. So your thumb is kind of not part of taking the pulse, just your index finger Vata, the middle finger Pitta, and the ring finger Kapha. And then the drawings, which is one of Dr. Laud's beautiful kinds of drawings he shares with his Ayurveda students and in his books. The Vata pulse is like a snake, the Pitta pulse is like a frog, and the Kapha pulse is like a swan swimming forward. So that will give you a visual reminder of what those are like. So this is talking about the bowel movements, and sometimes it's weird to talk about bowel movements, but it really is a way to understand our bodies. And so it has kind of types. So the first 2 or 3 are definitely more Vata types of bowel movements. This type 4 is somewhat more of a medium, but if it's huge, if it's big and fat, it could be a Kapha one, even though it's smooth and soft. But if it's heavy and there's some fattiness in the water from it, and it's very dense, then it's a Kapha one. And then these soft ones that come out easily, these 5, 6, and 7, these are Pitta types of bowel movements. So that gives you a fun visual I hope you don't have nightmares about that, but it's very useful to actually see it. So looking at your tongue, first of all, we have kind of a constitutional tendency on our tongue to have a Vata type tongue, a Pitta type tongue, or a Kapha type tongue. And that has to do with the shape and the coloring and whether it's dry or if it's like dry, like a Vata tongue looks kind of dry, whereas the Kapha tongue often has little bubbles of saliva on it. The Pitta tongue is usually redder, and the Vata tongue often trembles when you stick it out. It wiggles around a lot, and that's part of the Kapha or the Vata tendency towards movement. So these constitutional signs, like if there are lots of cracks all over the tongue, that's a Vata sign, a strong Vata constitutional sign. If there are lots of red dots around the tip of the tongue, that's a Pitta tongue. And Kapha tongues are often big. They're wide and full and thick. So this diagram is from Dr. Laud's book on Ayurveda, and this is for when you're looking at your tongue in a mirror. So it's not the same as when you look at someone else's tongue. So when you're looking in the mirror, it's kind of everything's the opposite. So the is going to be on this side, even though in your body it's on your right side. In this picture, it's on the right side. It's not the opposite. Like if you were looking at my tongue, my liver would be over on the left side when you're from you, according to your viewpoint. So when you look in the mirror, it's kind of the lungs are on the beginning of the tongue, the heart's in the middle of the first third of the tongue, and then the stomach and the intestines and the pancreas, the spleen and liver, and then the kidneys are more in the back, as is the colon. The spinal column goes down the middle of the tongue. So these are some signs of Vata on your tongue. Cracks, and these can be related to nerves in the large intestines, to having sensitive nerves or nervous indigestion. Tremors, like I mentioned, that the tongue can kind of have a nervous kind of movement back and forth. And this can be related to anxieties or just general Vata. This midline crack can be spinal column problems, and sometimes you can actually see where the problem is. So the neck is over on this end and the tailbone is at this end. So you can kind of gauge where on the spine, if there's a break in the line, that there is some kind of disturbance. And then teeth marks around the side, it shows poor absorption and assimilating nutrients. It's also related to inflammation, especially in the digestive tract. So Pitta signs are red, lots of red. Anytime there's extra red somewhere, or if the tongue is very red all over, that is a Pitta sign. So in this picture, on the left, the white with red perimeter, it's kind of up more in the middle of the tongue, and that would be where the small intestines are. So it could say that there's Pitta in the small intestine, whereas the second picture, the spot is lower in the heart area, so it indicates Pitta in the heart. So when there's Pitta everywhere with lots of little spots around, that can be disturbance in the digestive fire. in general. And if the red spots are just in the lung area, it can indicate inflamed or infected lung or respiratory tissues. So Kapha tongue has, again, some frothy kinds of white or brownish. So the brownish is actually probably a vata influence on the kapha. And when there's frothiness in this area on the very left tongue, that's in, again, the respiratory area. So that would mean there was congestion or mucus, maybe bronchitis in that area of the tongue showing up. If it's further back on the sides, like the second picture from the left, that means there's kidney problems or congestion. And then the brownish with the dark spots may mean that there's some kind of a infection of the lungs. And the white coat all over the tongue means that the blood and the tissues are toxic with kapha and need to be cleansed. So here are some actual tongues. So the one on the top left is a very thick white coat, which I would say is relating to kapha or toxins, most likely, that and it looks like it's more in the it's not in the lungs, so it's in the more digestive areas, the stomach and the small intestine and the large intestine areas more predominantly. And there is a little crack down the middle in the mid back section. So that could be some kind of spinal thing going on, which could also be affecting the digestion if the nerves to the organs in the back are not functioning properly because there's tension or some subluxation in that area of the spine, then that can cause digestive problems. So the second, in the top middle one, is a thick yellow coat, and that would be probably could be related to either Pitta or Vata. I'd look at all the other signs that were going along with it. Another thing that you can tell is that when you look in people's mouths, if they're you can't tell if they had braces. So you could ask them if you have braces. You know if you have braces. If your teeth are very irregular, that's vata of the mouth in a constitutional way. So the geographic tongue indicates vitamin deficiencies. Often B vitamins are deficient. And then on the bottom left, you'll see there are lots of little cracks. That's the vata type of cracking of the tongue. That person doesn't have a lot of toxins, so they're just purely vata at that point. The second on the bottom is having more red around the edges. You see how that part of the tongue is reddish more compared to the other part. So that is kind of indicating Pitta is in the blood stream, and it could be that vata is creating that. You see again some of the tension or cracking down the middle of the tongue on that person. And then the one on the far right is more of a kapha tongue. It's wider and bigger. You can see how it is somewhat pale, and it has the scallops for the malabsorption. So those are some examples of real tongues that your tongue might look like. So appetite, again, is another thing we're looking at to evaluate ourselves each day. Is it changeable or easy to ignore? Or are we doing emotional eating? That can be also a vata thing where we're not actually hungry in our stomach. It's more like we're bored or we eat because we're upset. Or we're rewarding ourselves. Those are all kind of vata eating patterns. For pitta, if we're having the intense physical hunger, we need to eat regularly. We need to eat perhaps frequently, like every 2 hours or so to keep from getting hypoglycemic. That's a pitta kind of appetite. And sluggish digestion, but wanting to eat. So in other words, things don't move through the system very fast. They may sit in your stomach a long time and not come out really quickly. Constipation can be vata, but it also can be kapha just because it's slow. But there's a steady appetite, that's kapha. Sleep patterns, again, vata is the light sleeper, waking after 2 a.m. and difficult to go back to sleep and often doesn't feel rested. Pitta people or pitta pattern is difficulty going to sleep. And in fact, staying up after 10 o'clock can cause you to have more pitta. And the reason that's true is that, first of all, you may notice if you're paying attention that you might feel tired like around 8:30 or 9 o'clock, and then, but if you stay up till 10:30 or 11, you start to feel wide awake again. And that's because the pitta fire is coming into play and waking you up. It also often wants you to eat. So if you're not already in bed, you may find that you're going to be eating again. And this is the time of night between like 10 and 2 when your liver is detoxing. And if you're eating then instead, you're not detoxing as well. So you're actually creating more toxin and also increasing your pitta by staying up late and eating at that time of night. Kapha sleeps deeply and as often as possible. And with kapha, you want to especially look for sleep apnea if they are overweight and snore. But even if they don't snore, sleep apnea usually is related to blockages in the respiratory system. And when people have more weight, it tends to be blocked more easily when they lay down to sleep. And then they aren't getting a proper amount of oxygen. Something that wasn't on my chart that you can also use to evaluate on a day-to-day basis is your urine. And so if you wanted to really examine it, you want to do it the first thing in the morning to urinate in a clean vessel so you can smell it. If it has bitter or astringent, which are the vata kinds of flavors, that would be more vata urine. If it had a more spicy or rotten or acidic kind of smell, that would be more pitta. And if it was sweet smelling, that would be kapha. You also want to look at the frequency and how much urine as well as the temperature. So vata, you have less amount, but you go frequently, similar to having an infection. And there's also a tendency to urinate at night. Pitta has a large volume, not so often, and kapha has a high volume with normal frequency, more moderate frequency, and also a tendency to urinate at night. The temperature of the urine, which I haven't ever figured out how to tell, but maybe if you pee in a jar, you can feel through the glass if it's hot or cold. But Vata and Kapha are cold, but the Pitta urine is more warm. And again, color comes into play. So urine is normally a straw-colored, yellowish, but of course, herbs or supplements and B vitamins and foods like beets and other red foods can make your urine different colors. So remember not to be alarmed if that happens and to discount that and not think it's a disease. Let it be checked the next day when you haven't just eaten those things. So dark colors urine is a Vata disorder. So if it's brownish, if it's dark yellow, it could be Pitta. And if it's cloudy or bubbly, frothy urine, that shows Kapha is in the urinary tract. So also it can be that there's a blood disorder if it's reddish color, and you always want to get checked if you have a reddish urine because it can also indicate a kind of kidney disorder. So that's important to check into right away. So now I'm going to mention some longer term and constitutional tendencies that you can check on yourself to help you understand your constitution. So the skin, Vata skin is very thin and the blood vessels may protrude, may be darker than people of your own particular tribe that you are from. The muscles may be flaccid and there can be more darkened areas of the skin. So everyone's skin becomes more Vata as they age, and that's one way you can tell how old someone is by looking at their hands. If the skin on their hands is thin, and that may indicate they're older. Pitta skin has more muscles under the skin, and it is more subject to rashes, sensitive skin, as well as having more freckles and moles. And it tends to have fair skin while having reddish areas. And different colors can come about more easily with the Pitta skin in terms of, bruises or rashes and so forth. The Kapha skin is thick, even on the hands. So if someone is truly Kapha, you'll notice that their fingers and their hands have very thick skin. And the skin, there's a layer of fat under the surface everywhere on their body. Even if they're not overweight, it's the skin itself that is thicker. There's a dense feeling, and when I do the Mayan therapy, I can feel it when someone's is more Pitta or more Vata or more Kapha by how their skin is feeling to my hands. So smell is something, again, this could be under the more daily thing, but Pittas have stronger smelling discharges, more sweat, and it can smell stronger. So whenever you notice that you're having stronger than usual smells, you probably have more Pitta going on. Kapha can have a sweet kind of smell. Vatas don't tend to have as much of an odor. They're more dry, so they don't have as much of that. So reading the fingernails is another way to check in for a longer time period, not just by the day. So the moons are, if you look on the picture, it says Lunula, the moon on the thumb picture, everyone pretty much has moons on their thumbs, but if you have moons on your other fingers, that indicates some strength of your digestive system. If you don't, then you tend to have a weaker one and you want to counteract that. Striations, so the lines that are on the nail going up and down, or sometimes there are like troughs or bumps that go side to side on the nail. Those indicate times where you had a very difficult time with digestion or food. You may have had an injury or some kind of sickness that didn't let you eat for a certain time. But when it goes up and down like vertically on your nails, that's telling you that you're not absorbing, or you may not have enough protein or enough minerals, one of those, either because you're not eating it or you're not absorbing it. White spots on your nails indicate, if it's not due to damage, like your finger wasn't pinched, it could mean that you're lacking some trace minerals. Dry, cracked cuticles are indicating emotionally vata problems. Red around the cuticles indicates, again, pitta in the blood. And how strong the nail is can have to do with which kind of nail indication. More brittle nails that break off, those tend to be vata. Ones that peel tend to be more pitta, and ones that are very strong and don't really break off that much tend to be kapha nails. So reading the face, we can see doshas in our faces. So looking in the mirror, you could see vata gives thinness, hollowness, like hollow cheeks, or hollowness around the eyes. It can give irregular features. So if one side is different than the other, or it also gives narrow, a long face, and a face that is movable, like a lot of tics, or just moving the eyebrows, or making a lot of expressions all the time is more vata. Pitta gives redness, especially around the nose, intensity of the gaze. So pitta eyes will tend to be the kind that look like they can just look right through you. And the kapha eyes are more round and watery, and there's the thicker skin, some maybe chubbiness, and there's also the big luscious lips of a kapha, and those are things that people try to make happen with when they do Botox in their lips, or when they do injections in their lips to make their lips bigger and more plump. That's because they're trying to look more kapha in their lips. Most people have a mixture of all these features, so you're going to look for what's most predominant, what you see happening mostly in your face. So here's examples of vata, pitta, and kapha eyes. The pitta eyes they can often be more bluish. The vata eyes tend to be more dark colored. And again, the kapha is larger. The vata eyes can be kind of looking around more. Vata always movement, lots of blinking, and so forth is more of a vata signal. The noses, the typical noses for vata, pitta, and kapha. Vatas can have a pointier nose. Pittas can have a tip that has a reddish color to it. And kaphas can have larger nostrils. So these are some examples of vata type faces. You can see the long faces, and the darker eyes um, that go along with that. Here are some Pitta type faces. The hair can often be reddish or blonde for Pittas. And Pittas can also become gray earlier in their life. Some Pittas, there's actually a way that the hair becomes kind of burned by the Pitta in the head, and it causes the hair to go gray fast. They often have bluish eyes or gray eyes. So you can see again, there's a reddishness to many of these women, most of them who have Pitta type faces. And then Kapha type faces are more, again, the bigger lips. There can be a larger nose. There's a bigger eyes. The hair is often thick. It can be wavy. So sometimes there can also be clues to imbalance in the face. And if you buy a book about Ayurveda, they often will have a chart of the face that shows these things. And remember that when you see a sign of a sickness or disease, that you want to really confirm that with different kinds of information, not just one sign might not be a good clue. You want to confirm it with the pulse, with other kinds of things going on. So this is one example that, for instance, the eyes with the long crow's feet on the tends to mean weaker reproductive organs. And if you have thick eyebrows, it means your bones are strong. But if there's less eyebrow hair, and of course we can't tell if women pluck their eyebrows, they could be giving us the wrong signs. So again, you have to take all the signs, put them in perspective. If there's long, big bags or big lines under the eyes, that can be a sinus condition. If there's bags under the eyes, that's often related to kidney fatigue or congestion. If there's a groove in the middle of the nose, it can be related to hemorrhoids. If there's hair in the ears, it can be related to heart attack. If there's a line above the lips or on the sides of the lips where there's deep grooves, that can be grief. And if there's a square, flat chin, hypothyroid. So you see there's a lot of different ones, and this next chart has some other ones, some similar, some different ones. So if you're really interested in this, you can one area you can look at is above in between your eyebrows. If there's a line on the going up from your right eyebrow upward, that's a liver line. And if it's on your left side, it's a spleen line. And if it's in the middle, it's skepticism. Or I think it's both the liver and spleen coming together. So you can use the face diagnosis to help you get some more clues about areas that you might want to strengthen in your body. And of course, an Ayurvedic practitioner will be looking at these things to help you when you go see them. So that is the slideshow. And I hope that gave you some more ideas, kind of refreshing some more about Vata, Pitta, and Kapha and how they express in your body. And so one of the things that I wanted to touch on before we finish up tonight is how to weigh the factors that that are affecting you. Because when I mentioned about in the last webinar, our constitution is what we're born with. It's ingrained, it doesn't change. But our condition is what changes on a day-to-day basis. And it can be aggravated by all different things in the environment. So how do we know what's most important to work on and to change? So I'm going to give you some more ideas about that. So first of all, our constitutional factors are more important than environmental factors. So, example, a Vata person will tend to be going towards Vata diseases even if they live in a climate that is more Kapha. So I could live in the perfect climate of Hawaii, which is actually a climate that tends to balance all the doshas. And in that place, I would still, because Vata is my highest tendency in my constitution, I would tend still to get Vata diseases. So lifestyle has more effect than the environment outside. So, for instance, when I mentioned about staying up late, which is Pitta aggravating, you can still get a Pitta imbalance in the middle of the Kapha winter season because you're staying up late all the time and still get a Pitta kind of sickness. So lifestyle has a large effect. And what we take into our body is more important than external things. So diet, that's why diet is so important in balancing us, because it's stronger than the climate or the season. So even though Colorado, where I live, is a very Vata place, eating a more Vata soothing diet will have a very good effect to overcome that. One important factor is that mental and emotional factors outweigh physical factors. So you want to look at any kind of consistent emotional patterns you have. Those can overcome outer things like the weather, or even things like eating well. So the mental and emotional factors, and that's why Ayurveda also includes, besides the diet and lifestyle, it includes the meditation, yoga, and also helping to understand and work with the mind, because that is so crucial to our health. So the other thing that we need to factor in is how strong something is. So for instance, if you're in a very serious car accident, even though that is an outer factor, it is very strong. And so therefore, that is a very Vata trauma, and that could cause imbalance even beyond injuries. So there needs to always be some Vata balancing whenever there's some kind of an accident or trauma. So, and if you just have like ice cream once in a while, like maybe once a month or something, that's probably not going to cause you to have a kapha imbalance. But if you do it every night and you have yogurt for breakfast with bananas every day, you are bound to get a kapha Kapha disorders. Um, and then the idea that the more factors that you have going in the same direction, they're going to tend to be more of an aggravation. So if you skip meals, you drink cold liquids, you talk all the time, and you have a changeable schedule every day, that will add up to a vata imbalance eventually. If you did just one of those, it wouldn't be that likely that it would be deleterious to your health. But with all of these adding up, and that's why, so for instance, again in Colorado, where the outer environment is very vata, that will add in to any vata kind of factors that I have that I'm in control of. So it will tend to make vata more prevalent. Vata is always more causing of diseases. In classical Ayurveda, they have lists of diseases, and Vata has the longest list. It's like twice as long as Pitta, and 3 times as long as Kapha. So Vata is more troublesome. It's also easier to balance if you pay attention and work on it. So I've become quite expert in balancing Vata because that is my main challenge. And so I have lots of good tricks for that if you want help with, especially with your Vata. So I will encourage you, if you have questions or comments that you want to communicate to me, please email me at wisewomanhood@gmail.com. And if you would like to have a consultation, I would love to help you to find out what is your pathway with Ayurveda and to help guide your self-care as you go through this process of learning the language of your nature and Mother Nature and putting them together so that you can be on the healthiest path possible for you. I hope you'll come to the next webinar. And again, I do encourage you to watch all of them in order if possible, because they build on the knowledge of the previous ones. The next one will be using this knowledge on, okay, I have lots of Vata today, what am I going to do? Or I have Pitta today, what am I going to do? That's what we're going to talk about in the simple ways to balance with Ayurveda, which is the next webinar, that webinar number 3. Webinar number 4 is on digestive fire, and as I mentioned, that's very important because besides the doshas, the whole idea of toxins building up in the body is related to this digestive fire. If the fire is low, the toxins increase. If the fire is good, then the toxins decrease. And so that's what the topic for webinar number 4. And webinar number 5 is kind of putting together some ideas for you on Ayurvedic daily routines and how to implement that in your life to help calm your Vata, first of all, but also to just have this routine of self-care that will benefit you in a healthy way. So thank you for your interest, and thank you for taking care of yourself, because as you take care of yourself, that helps the world to be a better place. Have a good evening or morning whenever you're listening. Bye-bye.